There's a compelling sense that healthcare is heading into deeper crisis. As an individual, it can seem very difficult to know how could we make a difference, how could we address these problems. That's something I've been trying to do for a long time. If I look back on 25 years of trying to improve the healthcare system, I'd have to say that most of my efforts have been pretty futile. I've really made very little difference. It's been something of a personal crusade for me. I find that I have an unusual degree of empathy, and when I see patients suffering in the hospital unnecessarily, that's just something I have to do something about, whether it's a lack of patient safety or a lack of compassion and caring, or the kind of relationships that you see between health professionals when they start to get stressed. So I've campaigned for a long time on patient safety, on compassionate caring, and on trying to create a safe and healthy work environment for all the people who work in healthcare. I had a kind of naive theory of authority. I thought that if you could prove that care was better, produce more patient satisfaction, better clinical outcomes, was more effective and would cost less, then authority figures would just sign off on that. And unfortunately, I found that that's almost always wrong. So I've tried through various authority systems to change the system. I found myself on national committees. I've worked with the World Health Organization on strategies for patient safety and for putting people at the center of healthcare. I found myself even chairing a national committee that advised the government on how to improve quality and safety in healthcare. But none of those things, none of those systems, none of those authority figures were really willing to address the core issue of caring and compassion in healthcare. How can we explain this? How could authority figures not implement change that's better for patients than is cheaper, is more effective? Well, what I've learned through many experiences at different levels of healthcare is that the driving forces behind healthcare are to do with politics and money and technology companies and pharmaceuticals and intellectual elites and professional groups that have rivalries and all these kinds of things. And we need to find very different kinds of strategies for changing healthcare from within. In the middle of this, I found the most inspiring health leaders were often pushed aside. When the management restructure is put in place to save money or to try to make an organization most efficient, it seemed to me that it was often the people who cared the most, who looked after their staff, who did the right thing for their patients. They were the ones who lost their jobs, and they were often replaced with bean counters and bureaucrats and technocrats. How do we begin to change the whole world of healthcare? I think we've hit upon a better strategy, and that's to create a global international social movement within healthcare that connects together all of those in the world who are passionate about rehumanizing healthcare and strengthening caring and compassion. So we start off with those individuals who've reconnected to the heart of the practice and found their new flourishing on well-being and happiness and joy in their work again. And we start to connect them together in networks. And they can be in any part of the world. They come online to our online community. They start to share stories, ideas, to become inspired each other, to learn new practices. So the networks begin to flourish across the world. And then in certain places, just wherever the ground is fertile, you start to get a community of practice. This might be a clinic or a ward or out in the community or in a medical school. That's where a group of people who are passionate about this change start to do some real stuff. They work together to change the system, to change the way they care for patients. They work together to change the way students are taught, the kind of curriculum development. There's a new kind of leadership, and these communities of practice really begin to make progress in compassionate caring, and they start to publish their work and share ideas and speak at conferences. So in different places in the world, you have communities of practice, and then they start to link together. And when they link together, something really interesting happens. These new practices start to become the norm, and when we get to a certain tipping point, that's maybe about 15% of the healthcare system, pow, suddenly the whole system flips. And that's when the authority figures, all those people in the committees and the WHO and chief executives, they say, well, of course, you know, I've always said this is what was so important, this is what we're here for. The authority figures then step in and support the work you're doing. So I think that's the strategy, to create a social movement that changes healthcare from within. Now we have a name for that, Hearts in Healthcare.